Good evening. Welcome to the Black Doctoral Network weekly web series, Conversation Starters. I'm your moderator, Fese Ilonge, and I am thrilled that you could join us for another wonderful episode. Tonight, we will be discussing African Americans in healthcare leadership, barriers and recommendations. And to facilitate this discussion, we have two wonderful expert scholars that will share their insight on this topic. Our first panelist joining us this evening is Dr. Radicia Brown, who is a best-selling author, international speaker, psychotherapist, and CEO of I Thrive Therapy. Her research interests include women's health. I welcome you, Dr. Brown.
Thank you so much. I'm so excited to be a part of this discussion tonight.
Thank you. Our second panelist joining us this evening is Dr. James Bush, who is a decorated military veteran. He's the assistant professor and program coordinator of healthcare administration at Life University. Research interests include healthcare administration and African American health in healthcare leadership, barriers, and recommendations. So I am excited to go ahead and get this conversation started. I welcome you both back, and I am thrilled. So let's go ahead and get started with our first question. How important is African American representation in healthcare leadership? Dr. Brown.
Oh man, this is so good. This is a great question. It is really, really important to have representation in leadership because it makes a difference in patient outcomes, right? And I'll tell you a story. So I'm a therapist. I'm gonna tell you a story, right? And so I remember I was working in ER. I was a therapist seeing patients that were suicidal, homicidal, doing assessments and determining where they needed to be placed. And so we had a patient come into the ER. He was 49-year-old African male. And so the ER doc asked for a consult because he said, hey, this guy's schizophrenic. He's hearing voices. There's nothing I can do about it. This is your problem, right? That's kind of how they operate sometimes in the ER. So I assessed the patient and determined, he does not have schizophrenia. Schizophrenia doesn't present in the way that's happening to him right now. And so the ER doc, of course, is like, it's my life and this is my world, right? And this is what I say. So luckily I had a contact of a leader in the hospital who was African-American who I could call and consult with. I'm like, hey, this guy really does not have schizophrenia. The ER doc wants to treat him for schizophrenia, which is psychotropic medicine and a whole host of things. But this guy does not have schizophrenia. Luckily, he agreed that we would have an additional evaluation, did a brain scan, come to find out he had a brain tumor, which was causing him to have hallucinations. So when we talk about having representation in leadership and healthcare is really important because it could be life-changing. And for that man, he could have been diagnosed with schizophrenia and being treated for an illness that he did not have. Had there not been an African American in leadership that would listen to what was happening with the patient. So it's really important to have representation.
Thank you, Dr. Brown. Dr. Bush.
I can't agree more. Obviously, of course, healthcare, the outcomes, of course, will improve with representation. But I want to also take a look at the administrative side of the house when it comes to leadership. So you have to also remember that those same leaders are dictating what's called the payer mix for a facility. And what that means is they decide what insurances that they will accept in that particular facility. Because, of course, we have employer-based insurances, and many, of course, of the Black and brown people in these neighborhoods have Medicare and Medicaid. If they decide that they don't accept Medicare or Medicaid, you have now been cut off, or your access to that facility has now been cut off because you can't, of course, perform those services there. So that definitely hits the bottom line when it comes to healthcare outcomes for our patients. Similar, of course, to Dr. Brown, I have a hospital story my background, of course, is in hospital revenue cycle, and I go into facilities and I train them and I consult them, of course, on their practices to increase productivity and to ultimately give them, of course, a return on their investment. And that means, of course, I'm seeing the CFO and the directors, and I'm in the C-suites. I'm there, and I'm the only brown face that's in there. And I remember going through Louisiana, and I'm not going to, of course, name the facility, but as I'm walking through, I pass one of the billers, and of course, it's an older Black woman, and she looks up and she sees my face, and then she sees me going into the conference room. Now I've been there for like 5 days, going back and forth, and of course if you know James wears a suit. I wear a suit in a heartbeat. Okay. Uh, so I go in, and on my last day there, she pulled me to the side and she says, "Baby, I am so proud of you." I am so proud of you, because I've never seen anyone go in there and command the way that you command those people, and talk to them the way that you talk. It's just, your mama must be so proud. And I think not only is it important for us to be there for those healthcare outcomes, but just the sheer fact of representation and how that must affect the psyche. Now, I'm not a psychologist, a psychiatrist, or psychologist, so I will leave that to Dr. Brown. But I can't imagine what that must feel like to be, I guess, what will be deemed the bottom of the totem pole, but to see someone coming in that looks like you, that is giving those orders to the higher ups. So.
No, thank you, Dr. Brown and Dr. Bush, for really highlighting the importance of the representation piece in healthcare. So just as we're going through and you all are sharing this wonderful information, as a reminder to our viewers, as our guests share their intellectual property, please make sure you give them their proper credit for their contributions. So the next question that I have for you all is, how has the current socio-political climate influenced diversity in healthcare leadership positions? Dr. Bush.
Ooh, okay. So politics influences all when it comes to healthcare and healthcare outcomes and healthcare equity in our communities. And so this is why it's so important for y'all to get down there and vote. Okay. So because your little vote then leads, of course, to Capitol Hill. So in most recent legislation that just passed, the HHS, Health and Human Services, is now focused on providing healthcare equity services to African American communities. Obviously, of course, things like the Affordable Health Care Act, but all those things are driven by what's happening in the social political world. So you would see, of course, many companies and obviously healthcare organizations revving up their D&E programs, or dusting off, I should say, their diversity, equity, inclusion programs, because they always had them, they just didn't use them. But it wasn't until they saw us marching in the streets and burning down targets and busting heads did they actually decide to maybe that we should probably look at that. Not to mention, of course, Dr. Anthony Fauci, as he got up there and he pointed out to the entire United States that African Americans are suffering the most here in this COVID-19 pandemic because, of course, our already pre-existing conditions that are, of course, a direct stem from our wonderful time in chattel slavery. So, but yes, social political climate definitely influences everything when it comes to our healthcare diversity in the leadership. My hope, of course, is after this time we don't get that nice little dip, as Americans' attention span to certain things is very, very short. So and until we get another unfortunately, until we get another BLM movement going in the streets, and or hopefully not another pandemic, I do fear that the attention that we're receiving on healthcare inequities is going to dampen.
Thank you, Dr. Bush. Dr. Brown.
Absolutely. It affects in every way, and especially when it comes to money, right? Healthcare drives it's a business, right? And they're in the business to make money. And so for Black and brown people that may not have the resources when you're going to get care, if they haven't allocated funding to be able to service you, if you don't have the right insurance, then you're not able to get the best health care, right? And so the political framework that's happening absolutely affects us, but we have to realize, no matter what your status is, no matter if you have insurance or you don't, our voices matter, and we have to use that to move to for change. We, as Dr. Bush mentioned, our vote matters, right? And when we don't vote, we see what happens. There is chaos, right? People doing and cutting services that we desperately need in our communities, where we don't have access to the best care. We don't have access to mental health. We don't have access to doctors. We don't have access to grocery stores just to be able to feed our families. And so when you see different parties in office, certain parties cut funding that services our communities. And so the more we're able to utilize the voice that God gave us, the more we're able to utilize the power we have as citizens, the more we're able to affect in a positive way the resources and services that we need to be able to care for our families, to live just like everybody else is living. And so, election is coming up. There's always change going on. I'm always at the, no matter how small the election is, look, my vote gonna count. Look, I don't care.
Exactly.
I'm gonna let you know. Right. And so we just have to have that mentality, that our vote matters and that we have power to change. So often we've been marginalized in society, especially as Black and brown people. We feel like it doesn't matter. Our voices doesn't matter. And in fact, it really does. And we've seen that firsthand in the BLM movement. Some things really change. Corporations start to listen and provide funding, because that's what this is about. It's about funding to provide access to care.
Speaking of that, there's in this, of course, it didn't pass, the Build Back Better Act from the Biden administration.
Right.
Well, one of the pieces in that legislation actually speaks about that gap in coverage when it comes to our populations. So I think all three of us are in the state of Georgia.
Right.
And so there's, of course, a peach care for the indigent population in the state that probably can't afford full coverage for their kids. And there's, of course, other access out there. Well, the federal government provides Medicare. And then, of course, the state of Georgia provides something, but you have to meet a certain income for that. And then a large chunk of our people fall in that gap where they're not covered, and you're forced to then go out to the marketplace to, of course, try to get some insurance. Well, that particular bill that's out there that cannot get through, okay, because certain people didn't vote during certain times, that could not get through, would cover that and allow those two, the peach care and the Medicare, to meet and close that gap. That way you can go and get Big Mama blood pressure checked because it's been a minute. All right. But absolutely, it all boils down to, the social and political climate that we're in.
No,
absolutely.
Thank you both. I love how you all highlighted the importance of voting and how that is connected and has a trickle-down effect to the social political climate. And I think our viewers are very intrigued. We have a lot of people tuning in. And for those that are tuning in, please feel free to share, comment, like, and ask any questions that you may have. We have some expert panelists, scholars, philanthropists here that will provide the wonderful insight surrounding this topic. So I believe we do have a question coming in the chat. So from, I think, Charisma00, how do we help persuade healthcare facilities to understand the wide-span level diversity among patients to adequately provide care to specific communities? I'm going to give you both an opportunity to answer this. Go ahead and start with Dr. Bush.
All right. Well, first of all, Charisma, I like your name. Okay. I'm gonna get me a T-shirt with it. All right. So I I think what would need to happen in this particular instance is partnerships or community partnerships with the facilities. When facilities, and a lot of them, of course, are owned by larger corporations like Wellstars and the Piedmonts. These big names, the Banners, these larger corporations need to, of course, then find partnerships with the local community healthcare organizations. There are tons out there, and through these partnerships, they can reach those diverse levels within the actual community. And then hopefully, of course, through these partnerships, they can see, of course, well, possibly I need to bring on some more diverse individuals. The problem is with that plan initially is that you have to have someone at the top who thinks or has the forethought to go out to the community. And quite frankly, Bob is not going to venture outside of his neighborhood to go to the community where his hospital is located. So that is definitely, I mean, it involves us trying to get our foot or wedge our foot in the door. Dr. Brown and myself are doing the work currently to pry that door open. But once we get there, we have to, of course, remember that we have to, obviously look back at our communities to try to get that information out there.
Thank you, Dr. Brown.
Absolutely. And Charisma is my sister's name. So, girl, is that you? That's my sister. Listen. Companies, healthcare facilities understand financial impact, right? That's what they are primarily driven off of. Mm-hmm. And so they understand when their client, their customer, the people paying them request for certain services. They request for representation. They request for a certain kind of machinery. They request for certain kind of drinks. And if you don't have those things, then I'm going to take my business elsewhere. We often think of healthcare as we don't get a choice, right? When you pay your insurance, when you work real hard on that job, taking all kind of crap you taking, half the time you don't like the people you're working with, you do it partly to be able to provide to your family. You get health insurance. You're not required to go to that particular facility. You get a choice. And so as individuals and as a community, if we make other choices, they listen. Because ultimately, Bob wants to stay in his comfortable community, driving his comfortable house, having his kids in private school. And if you're not utilizing his facility, that impacts him personally. And so as much as we hope people do the right thing just because it's the right thing, like why wouldn't you have a healthcare facility that represents the community, staff that represents the community? People live in comfort. And we are pattern-driven individuals. Whatever pattern we have started with, we tend to end our lives with. Unless some crisis level event happens, something major happens, we call it a healing event. Healing journey is what I call it when clients are ready to change. But until there is a financial impact, there is no change. And so that's where you utilize your power, you utilize community to make changes by choosing different facilities.
No, thank you both for answering that question so wonderfully. So this just leads us to the next question. I know we highlighted this throughout our conversation so far, but I want to really hone in on some of the barriers experienced by African Americans in healthcare leadership. Dr. Bush.
Well, so I did my study a few years back on, of course, barriers to African Americans in healthcare leadership, and I coined a phrase, "black ceilings." So there's glass ceilings for women. There's even bamboo ceilings for Asians. I wanted to target something that spoke specifically to the experiences of African Americans as they try to climb that corporate ladder. So I dub it black ceilings. So there's tons of black ceilings in healthcare organizations. Typically, when an African American makes it to the executive suites in the United States, it is typically in the role of diversity, equity, and inclusion. And that role is normally occupied by a Black woman in that leadership position. However, uh, that is not the only thing that we can do as Black people. You know what I'm saying? Why we got to be the diversity folks? Why can't I be the CFO? And why can't I be the CEO? And why can't I be the director of this or the VP of this or the AVP of that? And so you'll find, of course, with the data shows that most African Americans, correction, 9% of people of color are in healthcare executive roles or throughout all the hospitals and providers nationwide. That's 9% of people of color. And when they say people of color, they don't just mean Black people. They mean the Hispanic population. They mean Asians, island Pacific. So that it is. If you look at that 9%, that's probably way less than that. Especially seeing that we are such a large percentage of the population. So many of the barriers that many of those African Americans that I interviewed and that participated in my study, they mentioned, of course, tons of microaggressions. Well, Dr. Brown, we really like you, but if you could just
tone it down. That's what I get.
Tone it down. They say if you could just Kimberly was saying that you were just a little bit aggressive,
right?
In your tone.
Right.
I recall, of course, many of them saying, of course, having to be overqualified for many of the roles and still being passed up. Oh gosh, hair texture came up, of course, your actual demeanor, and quite frankly, even not even being offered certain positions, even though they expressed interest in those particular roles. So many of the barriers were more subtle. They were, for lack of a better term, the good old boy system was in place because as we probably already saw from a recent NFL lawsuit where the gentleman, I forget because James don't know nobody football now. I read books, so don't try to come at me chat about football because I don't know the man's name. But I do know, of course, the premise of the story that he applied for a position and was set up to interview for the position. However, it was already filled because he was not a part of that particular circle. Well, the same thing goes, of course, on in the executive suites because Bob and Linda all live in that same country club and their kids go to the same place. They are subject to typically in the healthcare industry or in any corporate setting, they do referrals, internal referrals. Well, you normally refer your friends, right, or the people who are in your social setting or in your network. Well, I'm gonna let you know right now, Katrina ain't in Bob's network. Jamal ain't in Linda's network. They don't go to the country club, and I'll tell you, quite frankly, I don't play golf. So my application would never even be seen because those jobs are already being given to those who they can rub elbows with. So those were some of the barriers that we saw or that I actually collected from those 30 participants during my study.
Oh, thank you, Dr. Bush, for your contributions and your wonderful study to really highlight, the reality of the barriers. So thank you for that. Dr. Brown.
I think Dr. Bush hit it right on the nose. Listen, all this dark chocolate makes them uncomfortable, right? I don't look like them. I don't talk like them. And so I get excluded from things that they like, things that they're comfortable with. And if you don't fit a specific mold, then you're excluded from even having the opportunity. It's a lot of microaggression. It's, hey, can you just calm it down? If you guys had known, I am on 20 most days, right? It's just my natural personality. And so that's too aggressive. That's too loud. Tone it down. Do this. Only say yes, ma'am. All these things that they have prescribed that I should be as a Black woman. Mm-hmm. And so, listen, God created me a certain way, and all this dark chocolate, and so I'm going to be who I'm going to be. And so you get excluded from things. You get excluded from leadership positions because they want people around that make them comfortable, because I'm used to golfing, I'm used to the country club, I have the same neighbor I've had since I was 4, his daddy know my daddy, who granddaddy, we all, did the same things. And so newness makes them uncomfortable, makes leaders uncomfortable. But the irony in the whole story is diversity makes companies better. We've seen it. It affects finances, it affects ideas, it affects how customers perceive the companies. Diversity works. But for some reason, companies, healthcare, they think Black leaders are only in the diversity and inclusion roles, right? It's like we've slated this one role for a Black person, Black or brown person,
Box
and
check.
and we did it. We on top of this movement. We are diversity, right? And so until we utilize our voice to make changes, they will continue to do so. And if we look at all the major changes throughout our lifetime, having a Black president, right? Getting the right to vote, right? And being able to own property and to say this is my home, it all required us to move, to get out our own comfort levels. The fact is that only a small percentage of healthcare leaders are non-whites. You're talking about 9%. So out of that, as Dr. Bush mentioned, it's probably 2 or 3%, right? If that. And that should make us angry. That should make us angry as Black people, as Black and brown people. And we should utilize our voice to request and demand change. Listen, you running my card just like you running everybody else's card when you sending that invoice for me to pay, to put money in your pocket so you can send your kids to private school, so you can drive your new car, so y'all can take these amazing trips. Then the company, the leader should look like the clients in which you serve, the clients in which that you utilize for your livelihood. And so it is always a challenge in any business. We're talking specifically tonight about healthcare, but we could be talking about any industry. We talk about football. We talk about different corporations major corporations. When you look in the room, there is nobody that looks like us, but we shop in there every day. We spending our money, we get our check, we run into the store. But when you look at their boardroom, there's nobody to represent me, to talk about me, to help communicate the needs in which I have in my community. And so it's a constant struggle, being, as Dr. Bush mentioned, he and I, being at the table, it's hard. It is hard. Because you got to constantly prove yourself, prove your worth, prove that is important for you to be there, and that you shouldn't be the only one there.
No, thank you, Dr. Brown and Dr. Bush, for just really highlighting the level and severity of those barriers and providing us like a comprehensive overview of how it presents in each and every daily life. So I thank you. So the next question that I have, we talked a little bit about this, but I want to really hone in into the organization in itself. How does organizational culture influence the retention of African American healthcare leaders? Dr. Brown.
Listen, when the environment is at a place that is hostile, where it's uncomfortable, where I'm made to feel like I'm not important, and as a woman, as an educated person, and I have another choice, I'm going to make another choice. Nobody stays at jobs like they did back in the day. They stayed for 30 and 40 years, hired there at 18, retired at 60, right? There's no loyalty, anymore. And so we as workers have gotten smart and realizing that I don't have to take this just because that's what you're offering. We've seen it with the pandemic. What the pandemic showed us is the importance of line workers and how line workers contributed to millions of dollars of loss for companies because they weren't in place to do the hourly job that they were paying for. They were being paid for the $12 an hour. That $12 an hour job cost the company $10 million, $20 million, right? And so what you're finding now that companies, there's this big push for 2022 to improve wellness programs, for companies to improve wellness programs, mental health services, healthcare options, providing funding for them to go to the gym and do these things to help with their overall wellness, right? I get lots of calls from companies that are, okay, how do we improve it? How do we make it better so that our employees stay in, so that they retain employees? Because it costs a lot to train people. And so for African Americans in healthcare, if there is an environment that's constantly hostile, where I'm constantly having to prove myself, where Bob is like, if you don't golf, you can't hang out, right? It's like, no, I don't have to do that. I get to have a choice. And I say no, and I'm gonna move on. I'm gonna take all the dark chocolate someplace else. And so employees now are finding their voice. They're finding that they can choose. You don't have to stay with a company just because. And
Mhm.
so we're seeing the same thing in healthcare. People are leaving. Medical people are leaving. Every day, people are hiring, begging, pleading, bonuses, trying to retain people. But what they don't realize is not about money. People usually don't leave jobs because of money, right? They leave jobs because of culture.
No, thank you, Dr. Brown. Dr. Bush.
Nail on the head. The people do not leave the job because of money. If they leave it because of people, uh, they leave it because you are working my last nerve.
Right.
Um, the healthcare is a field like no other. It is probably one of the only, or I mean, it's other fields too, but where you are literally walking in the door to take on multiple people's burdens, right? You're walking in to take on other people's burdens for 8 or 12 or 14 hour shifts for some of these individuals. And as of course Dr. Brown stated, the pandemic did not help with this particular process, because when you look at, of course, the essential workers in that pool, most essential workers, of course, are people of color. Most of your CNAs at these facilities, right?
Mm-hmm.
Hey, your medical assistants, your PCT, your PCTs, your phlebotomy techs, all of those individuals who help do the what seems like the minuscule work, but that is actually the big part of the work, because you only see the provider for 15 minutes. All right. Um,
Right.
right. You only see the provider 15 minutes, but you don't spend 30 minutes with Rhonda, uh, you know, with the fresh
Right.
bob. Okay. With the fresh bob. You done spent 35 minutes with her. So what you're experiencing, of course, not only is burnout, and your Dr. Brown was right. These companies now are battling, of course, to get more employees on board, offering bonuses, etc. But that may not be good enough, because you have to take a look at the company's culture. What about that company's culture made me say, you know what, it ain't for me. I'll go and do something else. Okay. And part of that, or part of improving that particular culture, is understanding, of course, diversity, understanding that for a Black family, my cousin is my sister. So if
Right.
my cousin is sick, I'm literally telling you my sister is sick, and therefore I'm telling you that it's my immediate family, right? So the definition for immediate family is different for Black people. Well, you would know that, of course, if you did not have someone who maybe understood us as a culture, or us as a people. So it's simple things like that. It's also maybe incorporating what are called ERGs, employee resource groups. Those are great ways for companies to include medical facilities to create community within the community, right? So if we're just having maybe a Black healthcare workers ERG, then I'll have someone else who I can lean on and say, you know what? Oh my goodness, this new mask that we have now is messing up my skin. You got some lotion? All right. I can't say that, of course, to maybe one of my colleagues who don't, use cocoa butter like we do. So these are important things, and they seem trivial and minuscule, but they actually help improve that environment, because you are spending countless hours of your day. If you're spending up to upwards of 12 hours of your day at work with your colleagues, right? And you sleep 8 hours, how many hours does that leave, of course, for you with your actual family? So that means a big part of your culture needs to be, of course, at least something that I can deal with so I can hopefully stay for the 30 years, which we're not doing no more. But or at least as long as, of course, for the time being. And lastly, part of that culture is also fostering an environment for growth and for professional growth.
Right.
Some of these facilities want you to stay a CNA the entire time, right? You're a psych tech and you're going to be a psych tech for the next 20, 30 years. I'm never going to put you on track. Because, and I know you said you wanted to go to school, and I know you mentioned that particular program was a daytime program, but I'm sorry, I'm going to have you work this 8 to 8 anyway, instead of fostering that environment for you to grow or doing what I need to do as a manager to put you on the night shift so that I know you can go to school in the daytime. So that's also a part of making that influence and making that organizational culture better so we can stay as a people.
No, thank you, Dr. Bush and Dr. Brown, for really conceptualizing how organizational culture is important to retention of African Americans. So the next question that I have, because we've talked a lot about the barriers, and as we just finished talking about representation and culture, what are effective strategies that leaders can implement to promote diversity, equity, and inclusion in healthcare organizations? Dr. Brown.
I think the first thing that leaders need to do is to ask the question. Like, it's not rocket science. Talk to your people, right? It's oftentimes it's like they'll be in the room creating something. We just got to implement this new program and we got to bring in these consultants and all of that, when in fact they need to just talk to the people so they understand that maybe Bob, supervisor, is running off half the employees because he is aggressive, he's abusive, he's not flexible with his employee, and people are leaving. Like, have a conversation with your employees and take it serious. When an employee brings an issue, take it serious. Not just, oh, well, you know how those people are. They always complaining about something, or they always looking for something. Those type conversations that leaders have definitely impact the employee experience. And so when you are constantly having a negative experience and you have another option, guess what? You're going to have another option and you're going to leave. Healthcare is one of the industries where everybody, from the patient care tech to the doctor, to the nurses, to the various therapists, from mental health therapists to the respiratory therapists, everybody is in need and in demand. And there's constantly people asking, begging to employ them. And so if leaders are smart and they want to create organizations in which employees are happy to stay, that they're not coming in the door and leaving out the back, where if you're staying more than a year, you are the senior person, right? I get really nervous when I walk into facilities and it's like how the senior person has been there 9 months, right? Because people are churning and burning. And so leaders have to be open to really looking at the issues in the organization, listening to their people and fixing it. Like, okay, if you know you got a bad manager who doesn't like Black people, that's always aggressive, like, deal with that issue. Not like, let's not cover it up, let's not move it around, let's address the issue so that we can move on and do the work that we're here to do in servicing our clients. And so one of the most effective strategies, one, is to have the conversation, and two, is to take action. Like, we can talk about all kinds of things. We can bring in all kind of consultants. We can bring in all kind of leadership books and implement all these strategies and have more meetings, right? There's always the solution. We need one more meeting, right? And so we need to listen and implement the changes that your employees know what's wrong. They know it because they live in it every day. All you have to do is ask the question and make the changes.
Thank you, Dr. Brown. Dr. Bush.
Well, there's a couple of things that they can actually do. Again, to piggyback off of Dr. Brown, one, they need to realize that most diversity, equity, inclusion programs fail. They fall flat on their face, and many of them view what they call diversity light. They call it diversity light, and that's because people don't like to do things that they are forced to do, right? If I'm forcing you to do annual HIPAA training and I'm forcing you to do annual cultural sensitivity training, What they're doing at their desk is click, 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 click. All right, got my certificate. Ooh, I got 2 Black friends. It's a check of the box. So what they have to do is move away from that format of making it a quarterly or some places just a yearly checkbox. This also means just not hiring the Black woman as the diversity, equity, inclusion executive. All right, that means going beyond that, and actually listening to her and not sticking her in a corner somewhere and only pulling her out, of course, during those particular training sessions. They need to incorporate that into their mission. Because when you add diversity in your mission statement, that means it's something that you need to strive for every single year. If it's a part of the mission, if it's a part of the goals, that will influence the entire culture of the organization. Every organization has a mission statement that includes hospitals, clinics, on down. They all have mission statements. And that mission guides the organization in decision making. So if you incorporate diversity in that mission, it will of course drive the actual organization. The next thing they also need to do in that particular plan is make pathways to promotions. Pathways to promotions. For instance, I'm working with a facility here in the Metro Atlanta area, and they're working with a local community college. And I literally just got finished designing a curriculum that will transition their CNAs over into certified medical assistants. And then from there, they'll continue on their journey to get more credentials without having to leave work. And so I think it's a phenomenal thing that some of these hospitals and some of these organizations are doing, because they want to keep those people. Because as I mentioned earlier, a good chunk of those CNAs are Black women, right? This is a fact, people of color. And so do I tell her that she needs to leave the hospital to then go to school when I know we have the resources to make it happen here? So make pathways for promotions, and not just, of course, for the lower level. I mean, of course, even upwards. Set up, if I know that Dr. Brown wants to move over from the clinical side of the house to the admin side of the house, set up some mentoring with her so she can learn about how the facilities run on the back end, not just, of course, the front end.
Right.
And then lastly, put some numbers to that thing. They love metrics, they love numbers, they love key performance indicators and ROIs, which are return on investments. If you put numbers to diversity, and you could see, of course, how it's increasing productivity amongst your employees, how it's improving your retention rates, how it's not only driving, of course, those healthcare outcomes for your patients, but you also see during the employee opinion surveys that it's going up and everyone loves working here. It also sees, okay, well, I'm having less people call out. It could be something as small as that number. If you're tracking those numbers, then you're tracking, of course, how happy people are in your organization because, of course, the diversity. And lastly, focus on equity. Focus on the E in the DEI, right? So now that you have some people of color in these particular positions, look at the pay, right? Are you paying them as much as that white man? Right? We're going to be real. You have to look at equity. Well, many companies love to look at the diversity and the inclusion, right? But not the equity. Am I paying this particular person what they're worth? And if they were a white man, would they still get this particular pay rate? All right. So those are things that I think that can really drive an organization and improve their strategies towards diversity, equity, and inclusion.
No, thank you both, Dr. Brown, Dr. Bush. I am thoroughly enjoying this conversation, and I hope you audience members are. And this is another reminder, please share, comment, leave any feedback for our expert scholars here as they give us more insight into African American healthcare, leadership, barriers, and recommendations. So to continue the conversation a bit more, the next question that I have is, how can leaders address stereotypes and prejudices that threaten diverse, inclusive, and equitable organizational practices? Dr. Brown.
All right. So this is a great question because we are people. We are people of diverse experiences and lifestyles, and that includes the leaders. And so, oftentimes I always tell my clients that I'm working with, you cannot change something unless you're ready to acknowledge that there's a problem, right? And so, with leaders addressing the stereotype and prejudices that they have themselves, and that's the hardest thing for individuals to do, is to acknowledge that yes, Black people make me uncomfortable. Yes, I have these preconceived thoughts that they're not going to work, they're just going to be lazy, they're going to just be stealing stuff, all these prejudices that you had, because that's what grandmama and grandpa and the people in these at when we go to golf, that's the things that we talk about, those the kind of jokes we have. And so I take myself with me in all my experiences. So if that's been my experiences, that's what I've talked about. Those are, I have these prejudices. And so as a leader, that's how I'm going to run the company. That's how I'm going to make my decisions, hiring decisions, pay decisions, all of those things. And so if you want the organization to change, the organization is made up of people, individuals. And so we have to look at the individuals and being able to acknowledge that, hey, you know what? I do feel uncomfortable with Black people, or I don't understand them, or I don't have any Black friends, or I do think they're aggressive, or I automatically am on guard when I'm around them. Until you have an honest conversation and acknowledge the thing in which you want to change, nothing will change. And so we have prejudices on all sides, right? And especially as you, from the lower level workers to the hourly workers to the leaders themselves, we face it at every level in healthcare. And it's so important that we first acknowledge that we got a problem. It's really hard to change when you're sitting there saying, well, that's happening someplace else, but not here.
Mhm.
No, because I just experienced that today, this morning when I got to work. So no, it is a problem. And so the way that we fix it, one, is to acknowledge it, and then to put steps and change in place. Put change in place. We got to change ourselves first before we say, oh, we're going to change the organization. We want the diversity inclusion manager just to change everything, when I'm the one that's prejudiced, and I'm the one making the decision and putting her in the corner, that's and not support any of the programs or services that she's recommending, because I got my own beliefs about it. And so we have to start with ourselves, with honest discussions, to admit that there's a problem and to commit to changing. And you can change. You absolutely can change, but you got to have a desire to change.
Thank you, Dr. Brown. Dr. Bush.
And I would take that a step further, is not once the acknowledgement has occurred, the education can begin. And it is unfortunate. It is not, of course, our responsibility as the minority, or as the Black person in the room, to educate them on Black culture. But it start thinking about it as a chance to coach up, for some of us who've been in management before, to coach them up before you coach them out, or in my
Right.
case, cuss them out. Um, it, a lot of times this
No,
is your
that's right.
opportunity to kind of coach them up. Hey, let me talk to you real quick. Because old me almost came out. Let's have a let's have a discussion here on the side. Yeah, don't ever call me angry or aggressive. All right, that doesn't sit well with me, or an animal in any shape, form, or fashion. Right? Or hey, I'm noticing that you use a certain word, aggressive, with me quite frequently. It doesn't make me comfortable as a Black woman for you to use those words. And then if that relationship is there and they're open to receive it, then you can educate them further on that issue. And I know it's a touchy subject with many, with our community. I know of course, we're not monoliths. So for some people, they're not going to take the time to educate you.
Right.
James will take the time to educate you before I educate you, the street way. That's just how I am. But because I like you two, of course, I'm a scholar, so I want to understand your thought process first,
Mhm.
You know, and I'm like, okay, what are you thinking? All right, well, that's stupid. Now let me provide you with some some references and some resources to, you know, to bring you, of course, out of the dark and into the light, if you will. But I definitely think, of course, as Dr. Brown mentioned, you know, one, acknowledging it, and then two, you know, educating them, or bringing forth education. And it may not necessarily have to be you that does the education. That's what the diversity, equity, inclusion officer is there for. That's what those policies are there for. So.
Oh, thank you, Dr. Bush and Dr. Brown, for answering that question. So, the next question that I have is, what are some recommendations to improve the recruitment strategies of African American healthcare leaders? Dr. Bush.
All righty. Well, one, look within. I guarantee you there's someone who's a team lead right now, who is in the lower levels. They're probably an hourly employee right now, that has the has aspirations of moving up in management and moving up in leadership within your organization. So for starters, look within. They're there. Don't look at your country club, or some of your friends in your neighborhoods, because the likelihood of someone of a diverse nature, because we are still segregated as a nation. Sunday morning around noon is the most segregated time within the United States. Our schools are segregated, and therefore, of course, typically your neighbors are look similar or have the same background as you. So just don't go in your neighborhood when looking for potential. I guarantee you, somewhere within your organization, there's someone that you can mentor, and coach up to that next level, within the organization. The next thing that they can do is start looking, of course, at HBCUs. Okay. Historically Black colleges have wonderful healthcare programs, or in general, that's across the board. Phenomenal nursing programs, phenomenal healthcare administration programs, psych programs. I mean, so we're out there, and we are studying, and we are matriculating through these institutions. Go and tap some of those institutions. And lastly, if you're in healthcare, take a look at the National Association of Healthcare Service Executives. That it's 100% African American healthcare leaders in their professions. They're all at various levels, who are seeking, of course, executive roles. So those are my three recommendations.
Thank you, Dr. Bush, for those recommendations. And Dr. Brown.
Those were really great recommendations, Dr. Bush. So the only thing I want to add, well, two things I want to add is one, not to lie to people when you're trying to recruit them, right? So, don't sell them or dream and they show up and they like, this ain't what you described, right? It's kind of like them dating profiles you got it from 10 years ago, and you show up and you like, who that, right?
Catfish.
So you be catfishing folks. And so if you want to improve recruitment strategies, be honest and upfront, but also be flexible. We have different needs. We have different family dynamics happening. We got to be flexible with our employees, with our leaders, so that they are able to, one, have a seat at the table, but also provide services, which is what we're here to do, and have a voice. But if you only have a singular view of what the role is and the person serving in that role, then you're going to miss out on some great, amazing talent in African Americans. We bring the spark in in anything we do. We put a little sprinkle on it, huh? Okay.
Right.
So you're going to miss out on all that. You're going to miss out on all that if you just have one view and one perspective on what the person should be and what they should look like for leadership roles. And so we want to be flexible and look outside of your box, right? If you're always going to that same school, because that's where you went to school, that where your daddy went to school, that where everybody go to school, and your neighbors, everybody looking the same, you're not going to find the gems, the jewels, the sunlight that's going to help transform your facility. And so we got to think differently. We got to look at different places, like Dr. Bush mentioned, HBCs, which produce amazing, amazing people, amazing workers. And so you got to change your mindset around where are the employees, and you got to go and get them.
Definitely. Thank you, Dr. Brown. Well, I have to say, this was a magnificent conversation. I thank you all tremendously for sharing your insight and your expert feedback and just your scholarly presence and just being innovators and change makers within the healthcare field. So, before we go, I have one more question that I would like to ask the both of you. How has your affiliation with the Black Doctoral Network helped to enhance you personally and or professionally? Dr. Bush.
I will say, of course, it has truly helped to make sure that the research that you've done to get to whatever academic level that you are at currently, it helps give you a platform. There's no need, of course, for you to have set in class all those hours and or days and wrote countless pages for that research not to get out. So platforms like the Doctoral Network help us, of course, not only exchange ideas that will move our people forward. It definitely, of course, also gives us a platform to present to the world our, of course, research so that we can, of course, be a better people.
Thank you, Dr. Bush, for your contributions and your continued membership. Dr. Brown.
I love this organization because what it helped me with is connecting with other Black professionals that are going through having some of the same challenges I'm having in my industry, and that understand the experiences that we have, especially as you go through higher education. Sometimes you're the only brown person in the room, and what that feels like, and it can be really isolating and it feels really lonely sometimes. So being a part of a network of individuals that have had similar experiences that can relate to me, that we can support each other. I've attended a couple of the live events, and it's just always really supportive, people offering their support and services and connections and all of that good stuff. And it's just good to be yourself. Like, I'm loud and I like to turn it up. That's just what it is, right? And so being around people where that's okay, right? Where I don't have to be like, oh my God, I have to quiet down, or I'm worried about how someone is going to perceive me. Being in the room where that's accepted and loved and embraced feels really good. And we all strive and need connections and support. And so that's how this organization has helped me. And I encourage anybody listening, if you haven't joined as a member, come on through. Come on through. We waiting on you.
No, thank you, Dr. Brown, for your membership as well. Well, this concludes this segment of the Black Doctoral Network, African Americans in Healthcare Leadership, Barriers and Recommendations. But before we go, I wanted you all to have an opportunity to provide your contact information for the audience members in case they wanted to have more discussions with you. Dr. Brown.
All right. So come on over and chat with me. Say hi over at my website, drradicia.com, and that's DRRADISHA.com, or over at Instagram at Dr. Radicia Brown. That's DRRADISHA Brown, like the color. And so we have a good time, and I love hearing and connecting with others. And so every matter of fact, tonight, every Thursday night, I have a live video podcast. It's called Hello Healing. It's a podcast for Black women. We talk about everything from orgasms to dating, right, and everything in between. Myself, along with two other licensed therapists. And so if you're interested, come on over tonight at 9 o'clock Eastern at Hello Healing Live on Facebook and join the conversation.
Okay. Thank you, Dr. Brown and Dr. Bush.
Well, you're coming over my website too, but we ain't talking about orgasms over there. Mine feel boring now. I don't know. I got to go and see what that thing be like. All right.
Come on over. Come on over. We'd love to have you.
Mine, you can come, of course, to my site is Dr. J Bush. Dr. Is DRJAYBUSH.com, or you can reach me via email, drjbush@gmail.com, and of course, it's Dr. J Bush on all social media platforms.
Thank you, thank you, thank you. Again, this has been a pleasure having you both come back and just share your insight and your expertise once again. I thank you all profoundly. And our audience members also thank you for just being here and just really highlighting, the place that African Americans have within the healthcare system. If you enjoyed this segment and want to tune in for more, please join us on Facebook at Black Doctoral Network or join us on the Black Doctoral Network website or become a member. I'm your moderator, Fesse Longe. Have a good evening.